When we're talking today about the head and the neck, we are going to be stimulating the lymph nodes in the cervical spine, but we're also going to be using our neighboring lymph node groups down at the armpits. We're not going to bring it all the way to the groin lymph nodes, but we're just going to use our next door neighbors. And if you see this picture to the right, you can see the lymphatics are all connected. They're all over the body. So if you can get that clavicle or the collarbone and anything above it, so even this like ridge, if you move your shoulder and there's like that cut, it kind of dips in on the backside of the collarbone, anything there and up is going to be draining in that area. And then on the back side of the body, it's where your shoulder blades are. So if you feel for that shoulder blade and you can feel that ridge, sometimes you can feel like a little bit of a ridge towards the top. Above that point is going to be the head and the neck. So here's my collarbones, right? And then if I make that pronounced, you see that divot in there? So that's going to be a really important place for us to stimulate our lymphatic system. And then on the back side, my scapula, my shoulder blade is back here. I can't necessarily feel that ridge, but it's pretty much right here and then up. If you can place that arm here where the head and the neck are going to be draining. So lymphatic fluid, and remember, lymphatic fluid transports proteins and fats and all this other stuff. It's collected by the superficial and then the deep cervical lymph nodes. So superficial means like closer to the skin, deep means deeper in there, closer to the muscles. And so after it's in this area here, again, blue is the veins, green is the lymph system. After it comes down here, it's going to flow into the jugular trunks. So jugular trunks are going to be here. We have the jugular vein, and we have this little guy here is the jugular trunk of the lymphatic vessel. And so the left side is going to go on the left side, and the right side of the body, of the upper body, is going to come over here to the right side. These jugular veins are then going to transport into the thoracic duct. And the thoracic duct is the last portion of the lymphatic system before it gets connected to the circulatory system. And then on the right side, it's jugular into the right lymphatic duct into the vascular system, the circulatory system. But the body's a little weird. It can't be perfect. So 75% of the body is drained by the thoracic duct, that last portion of the lymphatic system before it pushes all that fluid into the circulatory system. Your left upper body and both bottom portions are drained by the thoracic duct, and then the right upper part of the body is drained by the right lymphatic duct. We don't know why. It just is what it is. That's one of those things we just have to accept the way it is. Why is it not left and right completely? Don't know. But that's where all the travel goes. So if we look at big picture, we have that left jugular trunk here that's draining the head and the neck, going down into that thoracic duct, going into the vascular system. And you can see the thoracic duct actually starts down low near the diaphragm, near your ribs. And that's how the lower body's drained up, brings all this fluid here, it connects, and then over into the veins. The right side, it's all by itself. Here's that jugular trunk into the right lymphatic duct, into the vascular system or the circulatory system. So looking at the head and the neck lymph nodes, the lymph nodes themselves are the filters, right? They break up all the waste product and they filter out all that. And so if we look at the facial lymph nodes, so it's going to drain and filter the skin of the cheeks, of the eyelids. We have the parotid lymph node here, kind of on the backside of your jaw. That's going to help drain the scalp, the cheeks, the eyelids. We have the retroauricular meaning ear. So retro means behind, pre-auricular means before, and peri means around, like perimenopause, right? We're around the age of menopause. So periauricular lymph nodes. So there's a lot of lymph nodes near the ears. And then we have the occipital region in the backside of the head. So those are the head lymph node groups. Then we have the neck lymph node group. So we have the submental, mental meaning your chin. So right under, if you feel the bone of your chin and you kind of hook into your chin, maybe you've had a cold or allergies and you've felt those lymph nodes swell up. We have the submandibular So mandible, meaning jaw. So submental drains the tongue, the lip, and the front of the mouth. The submandibular drains the cheek, the upper lips, the gums, the floor of the mouth. And then we have the jugulodigastric, which I never say that word, but basically it drains the tonsils, the soft palate, some of the throat, and some of the tongue. And so here's a more simplistic version. So we have all these lymph nodes here. So then we have the deep cervical. So cervical, again, means neck. So the purple here in this top picture is where those cervical lymph nodes are. And if we look at the bottom picture, we have 3 different layers of lymph nodes in the cervical area. So a lot of lymph nodes going in the neck. So if you can stimulate your neck, doing some sort of manual lymphatic drainage to the neck, even for just 1 minute, say you have no time at all to do anything and you're just doing the neck, you're going to give yourself a really good boost that day. Then we have our supraclavicular, supra meaning above, clavicle meaning collarbone. So right in that divot that we were talking about before, that's another really important part. So again, these areas are going to filter out all the anatomy in that throat area, in the neck. The supraclavicular is going to drain the chest wall, the shoulders, the upper arms. And most importantly, again, this is where the lymphatic system connects to the circulatory system. So this area is going to be super important to stimulate and keep moving. So again, another picture, just so that you can see why we're doing the certain hand placements. All right. So for manual lymphatic drainage, we always want to start near the collarbone, near the jaw, and near the neck, because these nodes serve as a gateway for all drainage from the head and the neck into the circulatory system. Gentle stimulation here prepares the system for deeper drainage from the other areas that we're going to be addressing. And again, these lymph nodes live the fat layers, but there's not a whole lot of fat on your neck, so we don't have to give a whole lot of pressure. In your abdomen, right, there's a lot of lymph nodes, there's a lot of different fat, and so we need to push down deeper, more moderate pressure, but you don't want to do that much pressure on the neck. So this is basically what we're going to go over today. Here are the techniques. So I'm going to share my screen and I'm going to show you. One thing before we get into this, if you see this woman, you see how the lines of MLD, they're going from the middle of her face to the outside portion. We're doing that again because the lymphatic system is cut in half left and right through that belly button. So we want to keep it in those zones. It's okay to push over, but everything is intact. There's no damage to the lymphatic system, so we don't have to reroute anything. So whenever we start with any sort of lymphatic activation, we always want to do the diaphragmatic breathing. That is going to stimulate the deep section of the whole entire lymphatic system. So if we were going back to that thoracic duct that runs through that diaphragm muscle, so spending about 10 breaths or a couple minutes doing deep breathing, that's where we're going to start. To perform the deep breathing, we're going to inhale through the nose like you're smelling roses. As you inhale, we want our belly to fill with air. So we don't want all that air to come in through just the chest. We want it to get down deep. And then you're going to exhale through the mouth. So axillary, that means armpit. So I'm going to stop sharing my screen here. All right. So lymph nodes, again, live in the fat, right? So we're thinking of the armpit, it's here, and it's in that upper arm. So any of this area, we're going to give moderate pressure, right? Because we're going down to the fat level and we're just doing some circles, moderate pressure in circles. And you don't have to have your arm up like this. I'm just doing it to show you because I know, that can be very tiring. So if you wanted to, like rest here or even have it down, just giving yourself a little bit of space here. So anytime we're stimulating the lymphatic system, we want to do it a minimum of 10 repetitions, but there's no maximum. So 10 wiggles, 20 wiggles, 1,000 wiggles, the more the better, but at least do it 10 times, okay, both sides. Next step, the collarbone. Again, where that divot is on top of your collarbone, some moderate pressure, light to moderate pressure. Use the pads of your fingers, don't use your nails. You're going to do little mini circles right in here. So you can either go cross or you can go right hand to right side, or you can do one at a time. Just whatever's more comfortable for your arms. Some people don't feel like comfortable if they're cross-armed because it might feel like they're choking themselves. That's okay. Use 2 or 3 fingers and just circles in that divot where that collarbone is. All right, so we did the collarbone area, and then we're going to go on the neck. So we're going to go to the front and the side, and we're going to do 90-degree turns. And then we're going to go on the back side and very similar. Here, so we're here, we're pushing back, and we're pulling down. Pushing back and pulling down. And again, there's not a whole lot of fat here. The skin is very sensitive, so go super light touch. So it's like little 90-degree turns, little quarter turns, quarter circles here. And you're wanting to go both sides. So whatever your comfort level is, either you can do both at the same time. I like to go right hand on my right neck, left on left, and kind of work the same way. You can go in the front and start around where the chin is and go down towards the collarbones. You'll want to use the pads of your finger, but you can also use the whole entire hand, so the pad and the fingers. It doesn't just have to be fingertips. So it can be really efficient. So about 10 or more repetitions here. So after that, we're going to go on the jawline and the lower face. So we are going to start around the chin. So if you place your thumbs on your chin and you hook around that jaw bone itself, you should already feel those lymph nodes. They're usually a little bit bigger. They're on, tucked in. There might be some fat and skin, but you should feel some bouncy resistance. You can do little mini circles with just the pads of your thumbs on your chin, and then you are going to continue that along your jaw. So hooking inside of that jawbone, massaging a couple circles as you go back towards your ears. So I'm here, and then I'm here. So I like to do it with my thumbs. You can do it with your fingers. That's fine too. Yep, looking good, guys. So again, the body is cut in half midline. So we want to start midline, and you can do those little mini half turns, tractioning the skin, just like that. So we're going to start on this kind of like the chin strap area. You can go, pretend you have a mustache. Go down towards with the cheeks. And I'm only using 2 or 3 fingers using the pads. You can do both sides. You can do both at the same time if you need to. All right, periauricular, so around the ears. So we're going to give Spock hands. You guys are older than me, so I'm sure you know what Star Trek is, right? Because if I know it, you guys know it. So the easiest and most effective way, Spock hands. And then 2 fingers are going to go above the ear and, in front of the ear, and then 2 are going to go behind it. And then you're going to give yourself a facelift, so up and back, more tight. So you can give more pressure if you have to, because again, we're trying to traction and wrinkle that skin. So facelift. So up and back. Yeah, and if you have to, Jordan, just do a in front of the ear and then behind the ear separately. That's okay too.
Okay.
If you have to go like this or whatever you need to. So then we're going to go mid-face. So very similar to where we did like the chin strap, we're going to go bridge of nose. So nose out to where your ears are. We're going to go under eyes. And we're going to go eyebrows. So starting in the midline of your body. So you got your lips, you got your nose. So you can either do them both at the same time. I like to go every other. It says, it's a little more rhythmic. And again, we're doing those little 90-degree turns, wrinkling the skin. Now, online, if you've ever seen head and neck massage or, other types of lymphatic massage, people might be doing strokes like that. That's okay. We want to get the sequence down. These are just super advanced techniques. These are the techniques that the lymphedema therapists do. And then we can go eyes, because God knows I need to get these dark circles out of my eyes. It's just kind of going back towards that ear.
Okay.
So nose, cheek. You can spend more time right under the eye. You can go on the side. Again, just addressing all the real estate of your skin, every square inch of your skin, because there's lymphatics all over. So if you have a specific area that's more sensitive or you feel it's clogged, you can spend way more time there. You can go on top of the eyelids. You're going to start midline and you're going to go out to the outside. Another cool little trick that's not written in this PowerPoint, but I like it, is you can do little caterpillars. So little squeeze and pull from your eyebrows. Just kind of manipulating that skin and that fat, all that connective tissue. You can do it, with your pads of your fingers too. Sometimes it feels just better to kind of lift it off of your face. And then we can do your forehead. And again, starting midline, going to the outside portion of your head. You can go hairline, you can go to the top of your, the crown of your head. You can go to the back side of your head. But remember, you're still in the midline, even on the back side. And you're going towards the outside portion, right? Because we stimulated those ear lymph nodes. That's where our focus, that's our target. And so even on the backside, we're going to say, hey, come over this way. Drain out where the ear lymph nodes are. Now, obviously, everybody here has hair and, it's tougher skin. So you want to give more pressure. You want to actually feel your skin and your connective tissue moving on your skull. This should feel nice too, because who doesn't love a head massage? Who doesn't love to get their hair washed? That's my favorite thing about going to the salon, is somebody else gets to wash my hair. Now that you've stimulated your whole entire face, if you need to do more repetitions, you can put your whole hand and do one big 90-degree turn. The pressure comes through the pads of your hand, but also the palm of, pads of your finger, also the palm of your hand here. You can work it together. So I guess we skipped to step 8. So we, same thing. You're just working up the head. So we did the forehead, we did the scalp. All right. And then we stimulated everything so far. So we worked up the ladder. Now we're going to work back down the ladder. And this is where, if there's certain areas that you want to spend way more repetitions, more time, you can. And so we're going to do Spock hands around the ears, because that's where those lymph nodes are. We're just going to wake them up again and say, hey, you guys got to do a little extra work. We just, cleared out our face. So about 10 repetitions. Good. Back to the jawline, working under the chin. Then you actually work on the skin, the areas that have maybe some inflammation.
Mm-hmm.
And that's going to naturally draw to those lymph nodes. And then at the end, we stimulate the lymph nodes again to say, hey, good job, buddies. Keep filtering out all this fluid and inflammation. Then the neck. Good. Remember, lighter pressure here just because there's not a lot of fat and connective tissue along the neck compared to other areas of your body. Wrinkle that skin. 10 repetitions. In that collarbone area, light to moderate pressure. Again, coaxing all that fluid and waste product. Hey, guys, come over here. This is where you're going to get dumped back into the vascular system. And we can do the armpit again. Ask our neighbors again for more help. Everybody gets a chance to pitch in. Good. Both sides, circles, and then deep breaths again. So about 10 slow, big, deep breaths, breathing into that belly. And then here's that summary again. So deep breathing, armpits, collarbone, neck, jawline, ears, basically the whole face. And then repeat ears, jawline, neck, collarbones, armpits, deep breathing. So I have a picture, like an artistic rendition of this with steps too.